Here is a carefully worded reply from the authors of multinational live LQTS study. Among individuals diagnosed with phenotypic and or genotypic LQTS who were risk assessed and treated in experience centers, LQTS associated cardiac event rates were low and similar between those exercising vigorously and those not exercising vigorously. Live LQTS study, Lifestyle and Exercise in the Long QT Syndrome, was funded by the National Institutes of Health and enrolled individuals between the ages of 8 to 60 years with phenotypic and or genotypic long QT syndrome. 37 sites from 5 countries participated during a period of about 4 years. Vigorous exercise was defined as more than or equal to 6 metabolic equivalents for more than 60 hours per year. Physical activity and clinical events surveys every 6 months for 3 years with follow-up was completed in February 2022. Composite endpoint included sudden death, sudden cardiac arrest, ventricular arrhythmia treated by an implantable cardioverter defibrillator, and likely arrhythmic syncope. Events were adjudicated by a blinded clinical events committee. Survival status of those with incomplete follow-up was ascertained by searching National Death Index. Of the 1,413 participants, 2/3 were females. 13% were below the age of 18 years and 35% between the ages of 18 and 25 years. Implantable defibrillators were there in 1/4 of the group. 90% were genotype positive and 49% had LQT1. 91% were treated with beta blockers, left cardiac sympathetic denervation, and or implantable cardioverter defibrillator. Interestingly, 52% participated in vigorous exercise, of which 55% were participating in competitive exercise. 37 individuals experienced the composite endpoint. 1 sudden cardiac arrest and 1 sudden death occurred in the non-vigorous group, while 1 sudden cardiac arrest occurred in the vigorous group. The overall event rate at 3 years was 2.6% in the vigorous exercise group and 2.7% in the non-vigorous exercise group. Findings were similar in vigorous competitive athletes between the ages of 14 to 22 years. Informed and shared decision-making discussions between patient and physician about exercise and participation in competitive sports is needed.